Okay, now let's explain all the mechanism of action of all anti-HIV medications at once. So let's imagine that there's a virus just floating around the body, and there's a CD4 cell. The virus will keep floating until it bumps into this CD4 cell and use a protein on the outer side of the virus to enter into the cell. The intramembrane inhibitor basically inhibits the entry of the virus into the cell, and this is the first mechanism of action. And once the virus enters the cell, it will use an enzyme that is already pre-packaged with the virus. The enzyme is called reverse transcriptase. This enzyme will use nucleotides, which are small amino acids floating inside the cell. These amino acids, the nucleotides, will be blocked back together to make the viral DNA. So the enzyme reverse transcriptase makes viral DNA by using nucleotides, which are amino acids inside the cell. The class NRTI is basically nucleotides that are defected. They are rigged amino acids. So these defected nucleotides will enter the cell, and the virus reverse transcriptase will use these defected nucleotides to make defected viral DNA. So this is basically how the class NRTI work. But there's another less effective way of inhibiting viral DNA. We can, as we said, use defected nucleotides, defected building blocks, or we can inhibit the enzyme reverse transcriptase itself. And this is the class NRTIs. They work by inhibiting the enzyme reverse transcriptase. But let's assume that the viral DNA is made and it's working and effective. This viral DNA will be integrated into the host DNA. So this fragment of DNA that the virus has just made will be integrated into our own DNA. And we can use the class integrase inhibitors to prevent this integration into our own DNA. And finally, let's assume that integration was successful. The viral DNA will read and will make viral proteins. Now we can use protease inhibitors to prevent the synthesis of viral particles and viral proteins. Knowing the mechanism of action is good, but most importantly, and the thing that you'll likely see both in practice and in the exam, is first the guidelines that we have talked about in the beginning, and the side effects. In the class NRTIs, we know that zidovudine causes anemia. Stavudine and didanosine both cause pancreatitis and neuropathy. And abacavir causes Stevens-Johnson syndrome in patients with HLA-B5 mutation. And this is what you'll likely see in the exam if a question about the side effects came up. In NRTIs, the whole class is known to cause neuropsychosis. They alter the mental status of the brain, and they can cause suicidality, they can cause depression, hallucination, psychosis, and they're also hepatotoxic. The class protease inhibitors is known to cause dyslipidemia with diabetes, and specifically indinavir can cause renal stones. And the class intramembrane inhibitors can cause skin symptoms, from scales to hard skin to bruising and erythema, mainly skin syndromes.